Is this treatment something you're familiar with, first of all?
Well, I know it's been used to treat alcohol addiction, and they found about an 80% success rate compared to cognitive behavioural therapy. And I know for gambling addiction treatment, cognitive behavioural therapy is about 30% effective. So really, we should be providing the best possible treatment to gambling addicts. But even better than that would be to prevent people becoming addicted to gambling in the first place. And to do that, we need to reduce the maximum stake on some of the most addictive gambling products. Fixed odds betting terminals is the obvious one. Allowing these machines to proliferate on every single high street and allow people to bet up to £100 a spin is obviously going to create more addicts.
And you had a huge gambling problem. You're now okay, you sorted it and everything, but what was your own issue a few years ago?
It was with fixed odds betting terminals. Yeah, I lost at least £16,000 playing these machines. You can bet obviously from £1 up to £100 a spin, and you can quickly get sucked into it and start betting more than you can afford. And that's what happened to me. And
you came off of the machines and all of the gambling through sort of therapy, wasn't it?
Yeah, it was cognitive behavioural therapy. There was a bit of a waiting list for that, and the waiting list for therapy at the NHS clinic for problem gambling is about 6 months. So I think if there's a drug available, then obviously it'd be better if addicts could have access to it.
Daniel, you stage interventions to take people away from gambling. Do you think a drug can actually work?
I would hope there would be one day. I don't think there's one present at the moment. I did take some advice from a psychiatrist this afternoon that specialises in addiction and had a look at some of the articles, and there's no actual clinical evidence to say that this drug works. It was described as anecdotal.
So the kind of thing you do, the counselling, the intervention, that is a better approach, you would say?
Well, therapy, as in like CBT, but 12-step therapy, there's Gamblers Anonymous, there's lots of help out there. So, yeah, at the moment, that's all that's available.
And Matt, what is it that causes gambling to be such a problem, such a growing problem we've just seen? What is it specifically?
Well, it's a multitude of factors. It's an individual's predisposition to it, the products that are available and the accessibility of those products. And what we've allowed since 2005 is the most addictive gambling products to proliferate in easily accessible areas, and that's what we need to address.
Can you ever truly recover from something like that, do you think?
Yeah, sure. I mean, it's a program. There's a worldwide program. Many millions of people recover or have recovered, and I think if there is ever a magic pill that could help, it would be fantastic. But there's nothing as of yet.
Just finally, do you think using these drugs, is that going to cause other problems? Should people just be taken off gambling rather than taking these drugs?
Well, I think what these drugs do is they dull your response to what you're addicted to. And I think they actually encourage you to do what you're addicted to while you take the drugs. So then you sort of relearn your relationship with that particular activity. Gambling addiction is an addiction like any other. It's very similar neurologically to cocaine addiction. So maybe drugs can help.